Hello. Hi, everyone. I'll just get started now. Righto. So what I'm going to be doing is doing a brief presentation on social safety nets before the panel discussion starts. What I'll do is give you an overview of the institutional environment in which we operate. I'll talk about some of the high-level thematic areas in which are very relevant to social safety net reform, do a deep dive into a couple of those areas, and then set up for the panel after. So I'd like to start off by talking about the larger macroeconomic environment in which we're operating, right? So if you look at where Sri Lanka was several years ago, pre-crisis, we had about 3 million people who were living in poverty, right? That was about 14% of the population. But now we've seen the economic crisis coming. We've seen COVID, we've seen fertilizer bans, we've seen sudden dollar depreciations, we've seen a whole series of issues which have led to our people's incomes going down significantly, certainly from a real income perspective, and also costs skyrocketing. So as a result, many people have been thrown into poverty. We're talking about, if you look at the UN stats that were released, I believe, a few months ago, they had said that about 6 million people are in need of humanitarian assistance right now. So lots of people are in poverty. The situation is really dire, and that's why it's so necessary to think about social safety nets and make sure that the people who are really in need, that they can really be taken care of in this current context. So, as I said, I'll start off by giving you a brief overview of the social protection programs in Sri Lanka. When we talk about social protection programs, we have social insurance programs, we have social assistance programs, and we have labor market programs. So when we talk about social protection for public workers, we have the pension schemes. There are private and contributory schemes like EPF, ETF, farmer and fisherman pension schemes for the informal sector. So we have that series of programs. The social assistance programs, which is what's really important at times like this. So we're talking about the Samurdhi monthly cash transfers. We're talking about PAMA, the public assistance monthly allowance, which is usually for elders. Other types of assistance for vulnerable groups like persons with disabilities, kidney patients, cancer patients. We have specific programs for people suffering from thalassemia and so on as well. We are also operating in an environment where you have free public healthcare, free public education, and there are also targeted programs for children receiving, the grade 5 scholarship, Triposha, and so on. And of course, at in emergency situations like what we're facing now, there are also emergency cash transfers that have been given. So there's that social assistance program as well. And then there are several livelihood development programs that are ongoing as well. So there's a whole series of these programs, which is good. Some could argue that, they've been subpar in terms of what they're achieving, which is what I'd like to talk about right now. So again, stepping back several years, in 2019, we found that there was about 3 million people who were living in poverty. And this was after having a whole series of different programs in place, right? So that's Samurdhi, pension, elderly payments, and so on. So what we can see is that the impact of some of these programs have been quite subpar. So Samurdhi has been able to take about 300,000 people out of poverty. Pensions have been able to take about 500,000 people out of poverty, or the Department of Census and Statistics says. But even with all these programs in place, many people have not been taken out of poverty, which then really begs of the question, how do we create a program that will allow people to stay afloat? Righto. So this is why reform is really necessary in many areas to respond to both emergency and long-term needs. Right? And I've spelled out a couple of these up front. And then, I'll do a brief overview of this, and then we'll go into more detail as we go on. So it's important to talk about coverage or targeting, which has been a big thing that we've been talking about, which is, are enough people covered? It's important to talk about the adequacy of benefits, which is, are people getting enough money? It's important to talk about the type of benefit that people are receiving. So do you give cash? Do you give vouchers? Do you give in-kind transfers? That's an important conversation that has been happening as well. Important to talk about the ease of access and delivery. How do you get this to people? Administrative processes, fiscal sustainability, because we're dealing with limited budgets. Especially in Sri Lanka, important to talk about depoliticization, the efficacy of the programs, which is what I showed earlier in my slides, and then also graduation, which is how do you make people self-sufficient in the long run. And when we're talking about all these different thematic areas, it's important to balance between competing needs. So in the short run, for example, it may be more pertinent to talk about the adequacy of funds and making sure that as many people as possible are covered. But in the long run, it's important to think about how, the graduation elements of it, making sure that it's depoliticized, making sure that the systems are actually achieving what it originally set out to do. So we should be thinking about all of these, but some of them may be getting a little bit more weightage in the short run. So what I'm going to be talking about are just a couple of these, and I'll start off by talking about targeting. Apologies, there are some issues with the slides, but I'll just try and go on despite some issues. So targeting, here we're talking based on a survey that LirneAsia did last year. We did it actually to measure the impact of COVID, but I thought it was quite useful to talk about it here as well. So what we found is that 30% of households received regular welfare payments. This includes payments like Samurdhi, PAMA, disability, and so on. Now, there was also this 5,000 rupee grant that was given during COVID. And what we found is that 71% of households received it. And this makes sense because in addition to the households that received Samurdhi, disability, and so on, it was also opened up to people who were on Samurdhi waiting lists. And then people who had lost their livelihoods were able to register and get on these schemes. So the coverage of that was actually much greater. But what we found is that there was issues in targeting with a lot of inclusion and exclusion errors. What we've done over here is we've segmented the receipt of these benefits by socioeconomic categories. So socioeconomic category A refers to households that have that are the most well off. So those that have the best education, the best types of jobs, and it's really a proxy for high wealth individuals. Then socioeconomic category E, what you see at the bottom, are really the poor people. So what we found in the case of regular welfare payments, for example, is that 7% of the richest people had regular welfare. Then on the other side, which is much more concerning, is that 55% of those in socioeconomic category E did not get welfare, which then really speaks to this issue around targeting. It was also seen to a much lesser extent in terms of the 5,000 rupee grant, but was there to an extent as well. Again, I think we've seen some sort of move in the right direction over there, simply because they opened it up to people who were on the Samurdhi waiting lists and whatnot. So there's some progress there. So in light of this, it's really important to think about new methods to identify those in need of assistance, because we really need to take care of this program. So what has been proposed under the gazette that was released in 2019 and the Welfare Benefits Act was to use proxy means testing, right? So that's using things like asset ownership. Do you own a tractor? Do you own a boat? Depending on what your livelihood is. What does your household look, what does the house you live in look like? Those kind of characteristics to look at whether you should or should not be getting welfare. And this is certainly one way that we can go about it, but it's also important to look at more options, particularly in the case of identifying the newly poor, because sometimes these sort of factors won't reflect sudden changes in income. So there are all these different types of new data streams that are being used. So there's call detail records, satellite imagery, all sorts of new data that are being used to identify the newly poor. And we're seeing evidence from Togo, from India, from Philippines, from all sorts of countries that this is really promising. And it's working out quite well in those senses. And there was, I think, actually a study done on Sri Lanka itself several years ago. So important to think about how we can use these streams, because this sort of data is generated anyway, so we don't have to undertake really costly surveys to identify this. And the other really good thing about using CDR and satellite imagery data is that it's real time. So we can look at how these things change over time very quickly. So I'll talk about targeting more as we go on if needed, but I'll stop there. The other thing that I'd like to talk about is the delivery mechanisms. So there are many different ways through which existing welfare payments are delivered. So if you look at the Samurdhi scheme, for example, it's delivered through Samurdhi banks. If you look at other types of aid, cancer aid, thalassemia aid, kidney aid, some are given through divisional secretariat, some are delivered through post offices. There's a whole different series of ways that it's given out. So what we're proposing is that we should explore transferring these payments through mobile money accounts and banks. And it is actually quite an inclusive solution. So again, what I have up here is some survey data from the survey that we did last year. Of the households that received regular grants from government, we found that it was 98% had either a mobile phone or a bank account. In fact, 75% of these households received regular grants, who received regular grants had both a bank account and a mobile phone. So it is something that we can certainly explore as we go on. And what we're proposing here is that you transfer the welfare benefits to bank accounts or mobile phones, and then allow cash out at all ATM branches and mobile money outlets. So I'll take the example of Samurdhi here just to compare what is and what could be. So if you transfer to an existing Samurdhi bank, there are about 1,000 Samurdhi banks around the country. You can see on the left here, the map that is put up here, you can see the red dots are where the Samurdhi banks are. And on the right, what you can see is the different cash out points that you have. If you do look at transferring via bank and mobile transfers. So then you can actually go and get your benefits from any of the different ATMs, maybe Commercial Bank, Sampat Bank, Kagis Bank, so on, as well as from all the different operator touch points. So Mobitel and Dialog touch points, different communications, and so on. So then what you have is that versus the 1,000 different touch points that you'll have with the Samurdhi Bank, you have over 5,000 touch points in this new different mechanism. So we should look at that sort of solution just to make it easier for people to go get their benefits. And we've mapped this out here by looking at transaction costs. So again, we've compared Samurdhi banks versus the new solution that we're looking at. If you look at the time on the distance taken to travel to the nearest Samurdhi bank for the lowest income decile, which is what you see on the extreme left, you'll see that they often have to travel about 8 kilometers to get to their closest Samurdhi bank. But if you transfer it to a bank account or a mobile money account and they cash out from those points, the distance that they will have to travel would go down significantly. Right? So it's worth thinking about it just even from this transaction cost ease of use element if we're looking at this particular delivery mechanism. So I will stop there and then leave it to Satya to take the panel discussion forward. I hope this has been useful in just giving you an overview of the system in which we operate in, the big thematic areas in which we need to talk about when discussing reforms in the area, and some of the other solutions that we've been thinking about. Thank you.